Hi, Dr. Tim Silvester here again. I wanted to make a video to follow up on our last video where we were showing you how we use bilateral weight scales to determine if you're bearing more weight on one side of your body than the other, and how that can relate to problems in your knee, your hip, your lower back, and essentially work its whole way up your spine. When we look at a patient's x-ray, what we're going to be looking at here is an x-ray from the front. This is a frontal view. What I want to see when I look at your x-ray is that your hips are perfectly level. Much like we see on this x-ray right here, if you take a look at the two crests here, the two hip bones, you can see that they're very level. And when we have a level pelvis, it's kind of like having a bookshelf, and all of the vertebrae are like books that are stacked on that shelf where they are straight over top. You can notice the spine is very straight because we've got good alignment through the pelvis here. And what I want to do is I just want to show you by contrast a patient that has an imbalance in the pelvic area here. If you were to take a look at this x-ray here, what you'll notice is that on this x-ray here, the left hip is really dropped down on this side. And this is one of the things that can cause patients to be bearing more weight on one side of their body than the other. You can see that because the pelvis is dropped down on the left, the spine has actually gone with it, how there's a curve to the spine, and the spine is compensated the whole way up. So this is an example of a leg length inequality, an imbalance in leg lengths. And this patient here would definitely have a difference when they step on those scales. They'd be bearing more weight on one side of their body than the other. And this here can be a major cause of knee, hip, lower back pain. And the point that I really want to emphasize here is that many of the patients that are dealing with mechanical pain in their back and their joints, sometimes they're taking painkillers, they're taking anti-inflammatories, they're taking muscle relaxants for their pain. And you can well imagine, it doesn't matter what you're taking, none of those things are going to address this misalignment here. This misalignment here is going to put tension on the nerve roots and on the spinal cord on the inside, which can lead to a whole myriad of health problems. So it's really critical that we get the pelvis level here. And there's really two ways that we do that. Sometimes we'll actually put a lift in the patient's shoe to lift that side of the pelvis up if their leg is physically shorter on that one side. Or the other approach can be to simply improve the alignment through chiropractic adjustments. If someone has a functional difference in the length of their legs, we can actually get their pelvis leveled simply by adjusting the joints in the pelvis here. So the take home in all of this again is to remember that if you have a leg length inequality, if you're bearing more weight on one side of your body than the other, it's definitely going to cause your spine to break down faster. It's going to cause degeneration to the joints and to the discs. But on top of that, it's going to be putting pressure on the nerve tissue, the nerve roots, the spinal cord itself, which can be the cause of a lot of knee, hip, lower back, spine pain. It can work all its way up. It can even cause headaches. So if you have a leg length inequality, it's really important that that be addressed one way or the other. If you've got any questions at all, please feel free to look us up on our website, gracechiropractic.ca, or give us a call. If you know of anyone that you sense has a scoliosis or you might sense that they have a postural imbalance like this, please feel free to tag them, to share this video with those folks that you feel could benefit from this. Again, I'm Dr. Tim Silvester. Thanks so much for listening.